E voltamos com
Now we are back with our Sex and Sexuality show. Every Sunday from 10 to 11. We have time here to answer your questions about health and sexuality. 3831-3882 is our phone number. You can call us and ask your questions.
Até às 19 horas está postos para anotar sua pergunta. Pessoal da internet,
youtube.com Sex and Sexuality on the radio.
Estamos aguardando a sua pergunta. E agora,
Rodrigo, that is 30 years old from Santos, is asking,
colocação.
Doctor, I need help. For some months, I can't help thinking about sex. If I'm having intercourse, I don't want to stop. My girlfriend broke up with me. I lose sleep over sex. I try to pay to have sex. It's really wearing me. Help me.
Dr. Alfredo Rodrigo.
Rodrigo is in trouble, and Rodrigo, you may lose your job and more. You have a sex drive, so you need to undergo a serious treatment. You can choose either in Santos or in São Paulo. You have to choose a sexual therapist, a good psychologist, specialized in human being sexuality. This sex drive starts to get so serious that it changes your life, your routine. You can't sleep any longer. You are always looking for a possibility to have intercourse, as if you were a drug addict or an alcoholic. That is also the addiction in sex, and you have to undergo a treatment. In São Paulo, there are many places, like Hospital São Paulo, Hospital das Clínicas, that take care of the sex addict people. In Santos, I don't know where, but there are medicine universities there. Research. Look for on the net.
Procura na internet, inclusive, deve ter lá.
Sex addict. And you'll be able to undergo a treatment. Because this kind of addiction can become so serious that the person can lose even the family, because he'll be far from his friends. You see, you've already broke up with your girlfriend because of this addiction. And like I've already said before, they lose their jobs because they are worn out, exhausted. They can't go to work. Some of them start to steal like drug addicts because they want to keep this addiction, to pay to have sex with men, women, prostitutes, any kind of person that you may have intercourse. So, Rodrigo, your question was really worth it, because you see that in our show you can watch and listen. So please, you are only 30 years old. You need to undergo a serious treatment. Otherwise, you have serious problems, not only health problems, because you can be contaminated by any STD. Then it will be even more serious, like any addiction. Rodrigo, you're a young guy and you need help.
Grande abraço em Santos.
Doutor Ari.
Dr. Alfredo falou nos finalmente, só reforçando essa vontade de
this sex drive is a disease, and then if you haven't protected sex without a condom, you can be contaminated by an STD. There is risk to your life.
E agora,
Now,
o senhor
Geraldo,
52 anos de
from
Pirituba,
Pirituba.
pergunta o seguinte: Doutor,
I
fiz uma
had
cirurgia de
an
hemorroidas há
hemorrhoid
3 meses.
surgery
Estou
3 months
sentindo
ago,
muita dor
but
quando
I
vou
feel
evacuar.
terrible
Evacuo
pain
uma vez
to
no dia. É
evacuate. I
normal?
evacuate once a
Doutor
day. Is it
Seu
normal?
Geraldo, lá de Pirituba, é normal?
Yeah, to evacuate once a day is normal, but the problem is the pain. If you are feeling a lot of pain when you are evacuating, after 3 months, there is something wrong. So if you're complaining now, it's because you didn't have this pain before. So something is not well. You can't feel pain when you evacuate. Maybe your diet is not suitable. Maybe you don't eat enough fibers. You can feel some pain when you evacuate. But you have to go back to your doctor to see what's happening. It's something natural. It's like urinating. You can't feel pain when you urinate, and you can't have pain when you evacuate. You have to be looked into. Yeah, Mr. Geraldo, you have to go to your doctor, the doctor that operated you, and ask him if everything is okay. He will examine you and tell you why you are feeling this pain. Hemorrhoid surgery is a very delicate, uncomfortable surgery. It will bother you, but just for some time. After 1 or 2 weeks, the person is reasonably well. But some people have this kind of problem. And then you have to be examined again to give you the comfort you need. If you take too long to set this appointment to your doctor, I think you should use laxative food, because the softer your feces are, to evacuate will be easier. Drink a lot of liquid, because this will make your feces softer, and then it will hurt less when you evacuate. Eat food kind of citric fruit with fibers, because this will help you make the feces softer, and other kinds of food that include fiber. But don't forget to drink a lot of liquid, because it will get more difficult, and set an appointment with your doctor. Big hub.
Faça como o seu Geraldo.
Call us and take part in our show.
E agora,
Now, Dona Maria Dirce, I have a relative that feels lots of pain in the left side, next to the groin. He has been examined many times, but the exams didn't show anything. Yeah, it's a complicated question, because the exams didn't show anything. So there are many kinds of pain that you can undergo an ultrasound, CAT scan, and we can't find out what happened. Maybe it can be caused by a muscle, a ligament. If it's a hernia, it would be easy to see. But you say that the exams didn't show anything.
Bom exame clínico, como a senhora está contando aí, não se descobriu a causa.
Then, probably, it's a pain that is related to a movement that he repeatedly does, the kind of activity. Some people that spend a lot of time sitting in one way than in another. So we have to try to use both parts of the body equally. Otherwise, one part will suffer pain. So it may be related to repetitive syndrome injury, because you are using more one side of your body than the other. So, go for a good GP to examine carefully. Is also to talk to him to find out what's happening in his life. So then he will raise his leg, force it against his belly to see what kind of problem the person has. So then you can take some medicine, some painkillers, anti-inflammatory, but you don't solve the problem. It's not natural to feel pain. If you are in pain, there is something wrong.
É comemorativo de alguma coisa, é sinal que alguma coisa está errada. É um sintoma que alguma coisa está errada.
Doutor Alfredo.
You've just reminded me something. I have a friend that owns a big chain of supermarkets, and he was in a Syro-Lebanese hospital. He was in, and he said that he felt in his belly something like as if something were walking in his belly. It was really uncomfortable. It was not a severe kind of pain, but he said something weird in his belly. And then he told his doctor, "You want to discharge me, but I'm not leaving the hospital until you tell me why I feel this in my belly." And the doctor thought he was arrogant. But even though he decided to ask for some exams, it was a tumor in his intestine, and the symptom was not serious. It was just as if something was walking in his and then he had to undergo a surgery and he was cured. So, Dona Dirce, she tells us about one case, a symptom that so far they couldn't find a reason why this pain is happening. But this person can be overweight, and then it can make the pressure on a nerve or a hernia, like my friend has just said, an inflammation in a muscle. Guga, for instance, one of the best tennis players that the world has already seen, he had to give up playing tennis because he had a terrible pain in his pubis. And Kaká, also the soccer player, a terrible pain in his pubis, and sometimes doctors do take some time to find out why. But a good GP, a doctor that can listen to the patient's history, will help you. A big hug for you.
Gente, nós vamos para
We'll take a short break. We'll be right back.
Saúde e sexualidade para todos nós, não é verdade?